So everybody knows that Act 47 presented the city with a lot of challenges. One of the big challenges was how we were going to get to 20% mandatory contribution from our employees when it comes to health care. This year, it's estimated we'll be spending $53 million just on healthcare costs, 53 million taxpayer dollars on healthcare costs. But what makes it a challenge is that by next year, that number is expected to grow to $64 million. Years ago, the city was in a position which is called a self-insured program. Basically, instead of paying a large premium to an insurance carrier, we partner with the insurance carrier, then pay as you go. And realizing and looking back at the history with our team and personnel, our Office of Management and Budget, and working with our consultants, we were able to see that we could see real savings if we went back to a self-insured program. Expected savings that would see the increase of from 53 to 64 moderated down to a more manageable 57, which means employee contributions. Employees that have had their salaries frozen for years won't be a salary decrease, but would be able to be afforded in the modest increase that will be coming in the future years. That was part one, how to get control of the costs of a healthcare system that are continually increasing, how to make it so that city employees would be able to afford it, and we can get to that mandated goal of 20%. The second part is, how do you create a healthier workforce? So it wasn't so much just saving money. It was how we could reinvest this money to create incentives so that our workforce has the ability to make their lives healthier. And looking at models that were out there, create a true model that over the course of the next 5 years will not only make a healthier workforce, but with a healthier workforce, lower the cost of health care. So all of this fitting together in a comprehensive package of health, wellness, and cost savings is a new approach to how the city is not just offering insurance anymore, but actually offering a full package to our employees to make their lives better. And with that, I'd like to go through the numbers with our budget director, Director Ashbaugh, but also take a look at what that actually means to city workers.
Great. Thank you, Mayor. Okay, we'll cover this. So, a couple key themes we're going to focus on. First, as the mayor said, we're going to talk about what it means to move from fully insured to a self-insured arrangement. We also want to talk a little bit more, the Department of Personnel representative here, about the increased investment in our health and wellness program and how that will play not only into employee health, but also health care, mitigating the cost increases of health care. As the mayor alluded to, it's also important to note that for city employees, we are going to be not only mitigating the cost for employee premium increases, but also maintaining the current choice and selection of benefit programs that are offered. So there's no change to the actual employee benefits that are offered to city employees, which is important. And also, finally, personnel will talk about, in addition to expanding the health and wellness program, adding some new leading practices such as telemedicine into our portfolio of programs so that we can increase employee access to health care, which also has a role in mitigating the increase of costs. And we'll talk about how that will come into play. So this slide here, the mayor kind of alluded to the key numbers. When we started our budget process, we were faced with a significant increase in employee health care costs. While most employers can kind of expect this as part of their financial planning process, one of the challenges we saw was that this projected cost increase were significantly over anything we were projecting. So one of the things, then we worked with Towers Watson and the Department of Personnel to look at some alternatives that we're going to talk about right now. And this outlays the numbers that the mayor provided. Okay. So one of the things that we were looking at is, under the Act 47 plan, we are required to implement cost containment measures, which include increasing the employee contributions from 15% to 20% of employee premiums. And while most city employees will get a 1% raise next year, we were also looking at facing the fact that with that 1% raise, confronted with the increased cost of healthcare premiums, some employees may be have an adverse financial impact. So we wanted to look at ways to not only reduce the rate of growth of healthcare expenses, but also lessen the burden on employees and their families, and increasing employee access to healthcare as well. And these are the numbers that we found when we did the initial analysis. Depending on your type of plan and level of coverage, whether single, employee plus one, or family, and type of plan, you are facing anywhere from $168 to almost $1,300 increase in employee contributions. Whereas under the move to self-insurance that we're able to talk about today, those increases are going to be significantly mitigated, so almost by a third. So depending on your plan option and level of coverage, employees will only increase their costs from about $43 to a maximum of about $485, which, when you factor in the other health and wellness opportunities that we're going to talk about, is going to help employees from a financial management perspective as well. And it's important to note that we've worked very diligently with the Department of Personnel, Finance, and Towers Watson to crunch the numbers, and we're able to review these with Act 47, the recovery coordinator, who approved the changes that we're announcing today. One of the things that with every financial management contract from a labor perspective, in budget initiative, we need to make sure that it's compliant with the plan. And with staging in or phasing in the increased employee contributions over 3 years, will be compliant from a plan perspective. And so we're happy to announce that we're able to do this to help our employees out. Let me introduce Stephanie Haugen from the Department of Personnel, and she's going to talk about another part of our initiative today, expanding the health and wellness program.
Okay, don't go anywhere, Sam.
Yep, I got the thing.
Okay, you're the controller of the clicker. They're always in control of the clicker, aren't they? Anyway, hi, I'm Stephanie Haugen. I am the manager of employee benefits for the City of Pittsburgh in the Department of Personnel. I just want to tell you, as somebody who's worked in benefits for over 30 years, this is the apex of my career right here. This is it. To have a fabulous leader in our mayor and a fabulous team in the group that's been working on this for the last year. Nothing is better than this. We have the synergy going in conjunction with our consultant Towers Watson that is really going to change the way benefits are given at the City of Pittsburgh. So I'm really happy and proud to talk about that. And I just want to acknowledge Todd Siegel, our director, and LaVon Shannon, our benefits supervisor, who's very shy and wouldn't speak today, but we'll get her up here next time, okay? What we've done is expand our existing City Fit Wellness program to include more wellness activities and also give a second round of financial rewards. It's kind of smooched down there. You can't really see it very well. Today, we have about 40% of our population involved in our wellness program. And what we do is we give a financial reward of $240 a year or $20 a month if, in fact, folks get the bio screening and the wellness profile and participate in that year after year. Those two things are the linchpin of the wellness program. They give people information about where they sit as healthy people, what they need to do to improve their health, some of the actions they can take. So what we're doing now with the extra money that we have available to us through the savings that we've recouped, we're going to offer a wellness reward number 2. We're going to add additional activities that people can perform. They can also get in if they're not in. Okay, if you're already in, if you've done the bio screen, if you've done the profile, we're right now going to debut a website on December 1st that shows all of this. You can go in, you can see your profile, you can see your bio screen, you can see where you sit, you can see where your high risks are, you can see where your medium risks are. There's going to be a list of activities that you can participate in. A lot of it has to do with coaching. A lot of it has to do with online activities. You have a virtual wellness assistant who helps you deal with these things. You track your behavior, you demonstrate your engagement, and you complete programs. And as a result of that, you're going to get another $240 $100 reward if you do those things on or before June 30th. We have to give people about 6 months to get involved in this, and so we're going to do that. And we're going to kind of put the money out at the last minute there in our last phase, beginning in August 19th and running through the end of the calendar year. But basically what we're doing is we're going virtual on this, and the challenge there is to help our employees bridge that virtual divide. A lot of our folks, so they say, do not have virtual activity. They don't have a computer at home, they don't have a computer at work, they don't have a cell phone. I find that hard to believe, but we'll see how that works. So to help bridge that gap and to help our folks really engage and complete and get healthy, we're going to have wellness gurus all over the city beginning January 1. And they're going to go to every single work site in this town. And they're going to talk to people about this program. They're going to get them involved. They're going to help them do what they need to do. We're going to show them how to use the internet, show them how to use their cell phones to do this. These folks are going to be registered dietitians, nutritionists, folks that really can help folks get healthy. So that's where we're at on this end. We also want to talk about on slide 9, thank you, sir, our strategic plan. Towers helped us kind of get going on it, and we've taken it. And, when we show you this next year, it might look different. But right now, what we have is a 5-year strategy to implement our value proposition and change our culture. And how are we going to do that? We're going to continue to work with the mayor and the city team doing right what we're doing now. We're going to continue to do that. We're going to stick at that. We're going to work for better cost savings. We have tons of programs that we're going to look at implementing next year to save even more money in our overall medical costs, which will be fabulous. The other thing is we have made, and we're going to continue to stress, the direct cost relationship between wellness and what we spend medically. We're not getting people healthy to spend money. It's a symbiotic relationship that really works well for everybody. The other thing is we're going to roll out a program called City Fit Pittsburgh. We're going to extend that wellness program to the entire city. We're going to use everything at the city's resources. We're going to model it off what they do in San Antonio. They've been in the business of this for about 8 years, I think. Fabulous, fabulous ways of getting people all over town healthy, not just our employees, all of our citizens. And the other thing is we're going to try to partner with other cities, including San Antonio, to have events together. Again, we're going to bridge that digital divide. Integrated health and wellness solutions, that's what it's all about. We're going to work next year to put our medical, our EAP, and our wellness plan into one solid unit. Saves a tremendous amount of money. Makes people more engaged in what they do. If they can go directly to their EAP through their medical carrier, it saves us money. It makes them more appreciative of the medical plan that you've offered them. So we're going to work on that. We're going to continue to expand City Fit Wellness like we just talked about. The flexible spending account, FSA, pre-tax savings on every penny that people spend for any of their health care coverages. They have a ton of that available to them now. We're going to get more people involved in that. We're going to really leverage that plan so people have even more financial reward for staying healthy. And our voluntary benefits, we're going to rework that entire program next year and make it more valuable. We want the whole thing to be sustainable. How's that going to happen? This year we had a special program for the spouses of our employees to come in, get the wellness screening, take the profile. We gave them a $100 gift card. We want everybody, the entire family, to be involved in our medical coverages. We want them to be engaged. Engaged is a big buzzword right now in HR, but what it means is you get people fired up, you get them interested, you keep them active, and the rewards we just talked to you about. And the other piece is results. What we'd really like to see is, our experience go down, our chronic conditions go down. Our chronic conditions today, and this is shocking, but our chronic conditions today are cancer, musculoskeletal, I really have a hard time saying that word, and behavioral health. People are so stressed out. They do not take care of themselves physically. They do not take care of themselves emotionally and spiritually, and when you put that all together, they are very non-productive. So we want to change all of that. And those are some of the results that we're looking for. Because if our people are using the plan, we don't want them to not use the plan. We want them to use the medical coverage, but we want them to use it to get healthy so that they don't become chronically ill. Targeting our programs, these are some of the things that we've always had, and we're going to continue to tweak them and roll out new things to be more relevant. And, the digital divide again, we've got to be mobile. We have a lot of people who aren't savvy to that, but we've got to help them do that. Personnel is going to help them do that. The wellness gurus are going to get them on board. The telemedicine we're going to talk about in a minute. But just a lot of things that we're doing in the technology world to enhance our benefit package. All right, Sam. One more. So we're going to talk for a second about telemedicine. A lot of people don't know what it is. Some people do know what it is. The health plans are offering these. These are fabulous opportunities for employees to increase their access to their doctors. What it does, it's a treatment model for minor illnesses. The coughs and the colds, the flu season, dermatology, and from our point of view, we also are offering the telemedicine in regard to behavioral health, which is huge. You can call somebody and talk to them about what's going on with you. That is huge. What it does is it gives people another opportunity to use care outside of the urgent centers and the emergency rooms, which are sometimes you're over-treated, the costs are higher. If it's something minor, you can talk to your physician online, or you can talk to another physician. You can do it telephonically. You can do it via video. We talk to our relatives in Florida on the video. This is what we're going to do with our medical coverage here. Our people work different shifts all over town. They can't always get to the doctor. You get sick, what do? You call. Well, gosh, I can't get an appointment for 3 days. That's not going to work. This is better. And it's the same cost to an employee as if they went to their doc. For the municipal group we're talking about today, $10. So you can see where the cost savings are as well. And they can prescribe meds when there's a diagnosis, et cetera, but it is just one of the few things that we want to implement, at least this year, to help people get and stay healthy and to save those medical dollars. So I'll get it back to Sam.
Yeah, sure, thanks. And I just also like to thank Towers Watson. They're our health and benefits consultant. They're here in the room, so if there's any questions for them, they've been instrumental in putting this program together, doing all the financial analysis, working with us to crunch the numbers and provide some perspective, best practices, and also some strategy around our overall wellness program. This is important to not only us as an organization and employer, but to our employees. And I think what's important to note also is that as an employee, not only are we mitigating the cost of the healthcare premium for employees, but by participating in the expanded wellness program, you can put almost $500 more into your pocket by just getting involved in this program. So it's a win-win all around for the city as well as our employees. So with that, we can open up to any questions anybody has.
Just explain again, how is the city going to save money being self-insured?
So this slide here, I accidentally skipped over, just kind of gives you a little bit of background. So one of the things we look at is, our actual, worked with Towers Watson to review our actual claims and experience history. And the thing with insurance companies, they're in a business to make profit. So when we looked at our actual cost of claims over the last few years, for instance, and these are just an example, we may have paid $30 million in actual premiums to an insurance company last year, but our actual cost of claims was only $25 million. So that $5 million goes to their profit, marketing, administrative expenses, and everything like this. By moving to a self-insured arrangement, the city will cut out the middleman, so to say, and then be paying the claims directly. And one of the things, while this doesn't entail a certain amount of risk, one of the things that is incorporated in this is what's called stop-loss coverage for high-cost claims, so that if you have, a number of claims that are, $1 million claims. Somebody gets in a, serious accident, you could be, or transplants, you could be in the hospital for days, months, weeks, and, hike up a lot of bills. So what the stop loss coverage does is it insures us against those high-cost claims. We looked at our actual experience, and over the last few years, we've only had no more than half a dozen of what we consider high-cost claims, maybe over $250,000 or $300,000. So by taking out that stop-loss coverage, we will be protected if we have 20 claims over that amount of expense. And that's a big part of our actual healthcare expense. It's not, a small number of claims actually produces or represents a large amount of your cost.
Sam, was 30 million the actual?
No, that was just an example. I can get you the actual numbers, but I don't have them off the top of my head.
How many years for the high claims?
We look at about 3 years, and that's usually from a actuarial standpoint what you want to look at, not just 1 year, several years.
And a half dozen claims.
Sam, the two
Yes.
insurers that the city has now, Highmark and America?
Yes, and that was recently procured by Aetna, so it'll become Aetna.
And the TPA will be Highmark?
I believe so. Is that yes? Correct.
Okay. And who is the vendor for the telemedicine?
Both employees,
Values.
both carriers are providing telemedicine.
Do you know the name of the company?
Aetna has Teladoc, and Highmark has one specific for their behavioral health, which I can't quote you at the second, and they have another one for general illnesses. So you can look on our website on, I can get those for you if you need
Thank
that.
you. Both insurers will be providing the telemedicine component.
Exactly.
Okay.
What's the amount that the stop loss kicks in?
We're going to be finalizing that. We're looking at some updated data. Probably around, I think, best practices are maybe $250,000 to $300,000 in that range. But we're going to be finalizing that in the next few weeks. And it's, I think, also important to note that these projections are already incorporated into the budget that the mayor submitted to the ICA several weeks ago. So we've been working on this for months.
So how does the piece work for opening this up to all city residents? How is that going to work?
San Antonio, yeah, sure. San Antonio has a great program right now that they do. It's a series of activities that they engage in. They incorporate the local health department, the county government, lots of resources from different areas around the city of San Antonio. And we're going to follow that model to, a lot of the things that we're asking for our carriers next year, we're going to renew our medical coverages next year. We're really going to focus on social responsibility. We realize that those carriers provide us a lot of free services, and they underwrite a lot of our programs, but they also need to be involved in CityFit. They need to provide us with some gateway to some activities that we need to look at. But we're probably going to roll that out just as soon as we get to it, hopefully before the first of the year. So you'll see that on the mayor's website, and you'll probably see a lot of publicity around the area and some of the things that we'll be doing. A lot of it's focused also on our highly vulnerable population, senior citizens, folks who are in public assistance. One of the things that Delta Dental is going to do for us, they're our new dental carrier beginning January 1. They've made a commitment to work with young people around town who don't have access to dental care. So that's going to be part of one of the things that we're going to be doing there. So it's just a large group of activities. Parks and Rec's going to participate in this with us. The biking program is a huge example of that. Lots of different things that you'll see. And, if you want us to, we can have another news conference about that when we're ready. Thanks.
And I think that's a good point. I mean, the big part of what we're doing is trying to integrate a lot of the pieces of what's going on in city government. So benefits is not just a program for personnel, but as Stephanie alluded to, Parks and Recreation, Bureau of Neighborhood Empowerment. There have been a lot of different initiatives that you've been probably covered over the last year. Grub Up, increasing, children access to health insurance. So it's really integrating all these different programs and, focusing not just on our employees, but our entire city.
Employees pay something now towards their health
Yes, correct.
Is it a,
Yes, there's different, for municipal employees, it's 15, for over 30,000 in salary, it's 15%, and for under that, it's 7.5, right? And then police and fire, it's a fixed amount per collective bargaining. I don't have this off the top of my head, but it's a little less than 15%.
do the bargaining unions have to sign off on it?
Yeah, we'll be working with them on all the contracts to address this, yeah.
Does ICA have to sign off on it?
No, this is from an Act 47 perspective, it's, compliant to the plan initiatives. So, and it's incorporated into our budget. And they're aware of it. They've, were shared with the information that Act 47 provided the analysis as well.
What's the reaction from the unions? Have you heard?
We're going to be talking to them. Collective bargaining is ongoing. We still have some contracts that have to negotiate, so. I think it's a positive thing. I mean, this is one of the challenges after sitting in the last few rounds of negotiations is that the number one concern was the mitigating the cost of health care when we only have a projected 1% cost or raise next year. So this is a way to do that. This is addressing, what we heard is one of their number one concerns. So I think we've delivered not only on mitigating the increase, but also providing an opportunity through increased wellness, putting more money back in your pocket.
So you would have to open up contracts with like fire's already signed.
Yeah, I believe that the fire contract already allows us to do this. So every contract may be a little different. So we'll have a different strategy for each one.
And employees won't have to change their individual health plans at all?
No. I mean, we'll have an open enrollment plan, so just like any normal year, if people want to change, those options are still there, but it's really going to be no difference to the employees. Visible.
Just to clarify the numbers, currently spending 53, the projection for next year was 64, but now through this it'll be
57, yeah. And this is also, I mean, this doesn't include, there are some, this is non-Medicare retirees. We have some Medicare plans, so that's outside of this because that's governed under different rules.
So I missed the beginning of this. Is Highmark and Aetna going to, is the city just going to pay through them or?
Yeah, they'll continue to be the providers. So employees, if I have Health America or Highmark insurance today, I will still, unless I decide to switch, will have that same coverage, same plan, no change to me as an employee what I have. And it'll just be a matter that we'll, instead of paying premiums to insurance companies, the city will be directly paying the claims. And so we have a process already worked out with the Department of Personnel and the Controller's Office to how we're going to manage that. And it's this, again, and several years ago, the city was self-insured, so it's not something that's completely new to city government.
How long ago was that?
Do you guys remember?
I think we
Started?
When did we start?
2007.
Okay.
And why did you stop in 2007?
I don't know. I wasn't around. If any chance, Levon, if you know, or just a choice.
Good price from Highmark.
Yeah. Okay.
Any other questions?
All right.
All right.
Great. Thank you.
Thanks.
Thank you.